A student in Toronto has launched a pilot project to help Syrian refugees get eye care. Tarek Bin Yameen has a very personal connection to his cause. The project is run in conjunction with St. Michael's Hospital and a non-profit group. And Tarek joins us now in studio. Thank you very much for coming in.
Thanks for having me.
Okay, so tell me how this works. What made you decide to help?
There's two angles. There's my personal angle. I grew up overseas in Yemen, and in 1994, due to the civil war and the fighting, my family lived as internally displaced refugees. During that episode, in the camp, there was an outbreak of cholera, and unfortunately, 40 people died within a week. I was lucky enough as a child to be provided with oral vaccinations, and I made it out. And that experience really motivated me to pursue a career in medicine. So after my family immigrated in 2001, I pursued a career in medicine. How I came up with this idea, I was helping a Syrian family resettle in Sudbury, and I got a call from their private sponsorship group telling me that the young girl had an eye condition that left untreated would result in vision loss in the affected eye. So I began wondering how many of the Syrian refugees here in Toronto and the GTA have eye conditions that are untreated.
How many have you found out have similar issues in terms of eye care?
Oh, so I mean, so we've ran 3 clinics to date, and I've run these clinics with my supervisor, Dr. Lichter, a staff ophthalmologist at St. Michael's, and we've provided vision screening to 500 Syrian refugees. About 50% of them are children, and about 200 were identified for either vision correction or medical or surgical intervention due to an eye disease. So these high figures represent the unique, complex needs of this population.
So you've seen their adjustment to Canada up close. I mean, how are they doing? We're in, about a year into the time since they arrived here. How are they doing?
So the interesting thing is the refugees, they do have federal coverage to access eye examinations, but they haven't gone to a doctor in about several months. And the reason is they face many barriers to accessing healthcare. There's transportation barriers, language barriers, there's poor health literacy. And when you're a refugee, just like I was once in my life, getting a roof over your head is your priority, not seeing a doctor. So that's where these clinics come into place. We address those barriers. So we provide buses to refugees to and from the clinic. We have translators on hand with the refugees from the first point until the exit. We book follow-up appointments for them. And then on top of that, it's a one-stop shop, this clinic. Not only do they get an eye examination, they have specialists on site ready to provide follow-up care right away if they're identified with a condition.
Now, you moved here from Yemen. How much did your personal experience drive this? I mean, you had that experience. You see that they're going through the same thing.
I mean, I do this all just for the kids. You know, when I see the kids, the vast majority of our population in the clinics are children, they remind me of me, and the challenges that I went through. So what I hope when I do these clinics is I'm helping these children, and just like Canada has welcomed me, these kids can pay it forward to the next newcomer wave and the next refugee wave.
Tarek, thank you very much for joining us, and good luck with that.
Thank you very much for having me.